Good morning. Welcome back. 7:41 now. School is out. Summer's here. It's time to take a break. Pull out the flip-flops and the swimsuit and enjoy some fun in the sun. Well, maybe. Be careful, though, suntanners. Extra exposure to the sun's damaging rays may leave you with dangerous skin conditions and even lead to cancer, which everybody knows that, right?
Right.
Well, we hope.
Well, they do. And actually, there was a very interesting study recently that looked at college students, asked them if they knew about the dangers of sun exposure, ultraviolet radiation, tanning beds even.
Yes.
Most of them said absolutely. But then they were asked, do you do it? More than half of them said, yes, I do.
Of course they do.
Yeah.
Everybody wants brown, nice-looking brown skin. Dr. DJ Verret here this morning. He's a facial plastic surgeon. Thank you for being here.
Well, thanks for having me. I appreciate it.
Well, tell me about what you're seeing these days. And you know, with the survey you just talked about, not many college students knowing about the dangers of tanning beds and the sun, but they do it anyway.
Right.
So,
well, what we see is two different things. First of all, we have, and it's every age. I've treated 20-year-olds to 90-year-olds with skin cancer. And there are three primary types: the basal cell, squamous cell, melanomas. The melanoma obviously being the deadly form.
Right.
And those are basically due to sun exposure or ultraviolet radiation exposure more broadly. And even tanning beds give you that same amount of radiation exposure. The other thing that I see a lot are cosmetically. People coming in saying, I have wrinkles, I have sunspots, what can I do to prevent those? And when we look at aging, we talk about two types of aging. Intrinsic aging, which is due to genetics. Can't do anything about it.
There's nothing you can do to stop it.
And then extrinsic aging, though, all of the other factors. And the biggest one is sun exposure, ultraviolet radiation exposure more generally. Ultraviolet radiation actually changes the composition of your skin. It decreases the amount of collagen in the skin, increases the amount of elastin, contributes to wrinkles. It basically accelerates the aging process. It increases the amount of pigment in the skin, and it also decreases your immunity to some degree. So you need a little bit for your vitamin D. Most sources, though, now are fortified with vitamin D, so you don't need as much sun exposure.
Right.
But if you get too much out there, and the tanning builds up over a lifetime and can cause all these kinds of problems.
So talk about some of the products you've brought. Well, now, does this deter skin cancer, sun damage? What do these things do?
Well, these products, well, one of them actually deters both, and that's sunscreen, and that's big.
Of course.
I mean, prevention is obviously worth a pound of cure in this case. Staying out of the sun, protecting yourself from it, wearing your sunscreen, reapplying it over the course of the day, making sure it's an SPF 30 or greater, has protection for both UVA and UVB. That will protect you against both sun damage and skin cancer. The rest of the products are more for the sun damage. We look to the vitamin A derivatives, the retinol, the retinol esters, available by prescription and over the counter for wrinkles and for pigment in the skin, hydroquinones for pigment in the skin, the antioxidants such as resveratrol, vitamin C for wrinkles, and there are over-the-counter products that actually work very well. But usually it's important to talk with a dermatologist or a physician to make sure that what you're treating isn't actually maybe a cancer instead of just treating it with some kind of over-the-counter product.
Right. Well, if you need any of these products, we'll have it up on our website later on today. If you are interested in purchasing any of these, you can check our website, KXAN.com, later today. Thank you so much for being here, Dr. Verret.
Well,
we appreciate it. Thank you for all the information. Yes.
Hopefully some people will protect themselves from the sun.
Yes, we hope so. Yes, thank you.